we're going to be going over the lateral ligament repair. We're going to repair both ligaments, anterior talofibular ligament, calcaneofibular ligament. We will do an additional internal brace from the talus to the calcaneus in this technique to provide stability to the subtalar joint. So we'll go over anatomic landmarks to set up your incision, the approach, identify the ligaments, look at the perineal tendons, and then do the repairs and kind of how Junko does this, the Junko way. And then I'm sure this will be done by Dr. Emery at some point. Dr. Aaron, I should say. Dr. Emery. So we're gonna mark out our fibula. Okay, so you can feel the anterior, posterior borders of the fibula, tip of the fibula. You can feel your tarsal sinus right here. Here's the anterior process of the calcaneus, loops up this way. So my incision for this, I start kind of up on the fibula, and it's going to be a gentle curve down. And that will allow us to get to the front where the anterior talofibular ligament sits, the calcaneofibular ligament, perineal tendons, which are running right down like this. And then we will also be able to do an internal brace from the lateral process, near the lateral process of the talus down to the calcaneus. So that is our incision. So we'll get started. So we're going to incise the skin and get down to basically the periosteum of the fibula, but not quite go through the periosteum. Obviously, anteriorly, we're watching for branches of the superficial perineal nerve. It's not bad, yeah. And then come back here, yep. And what you're gonna do, we wanna protect the superior perineal retinaculum. We don't wanna get through that because we don't wanna create perineal instability. So we're gonna feel the posterior edge of the lateral malleolus where the SPR kind of sits, and then we're going to open the perineal tendon sheath. So this helps us to identify the calcaneofibular ligament so we don't cut it. So there's the perineals right there. So we've identified those, so we know our calcaneofibular ligament is going to be underneath them, and now they're kind of protected during the remainder of the case, and we'll show that in more detail. So a lot of people ask, well, how do you find the anterior talofibular ligament? And what I will typically do, especially if it's not, if the anatomy isn't great, I will make an arthrotomy just anterior to the lateral malleolus. You don't want to get too distal near the tip, so you start up on the anterior face, you make your arthrotomy, you work your way down to the ATFL is how I do that. So basically the anterior face, yeah, you feel it right there. So my arthrotomy would be probably about like that. So you come straight down, you can go deep, and you're going to identify the talar dome, and the ATFL does not attach to the talar dome. So once you see dome, you know you're in a good plane. So we'll get down in there. Yeah, kind of, let's open that up just so we can see it. So that is just synovium that I'm pulling out there. And now, so the talar dome is right there. You can see it moving. And so then we can retract a little bit, and you can kind of look down and see, here are some fibers. That's going to be ATFL right there. And I can mark it with a pen too. So the ATFL is going to attach just distal to the lateral talar dome. And so this is part of the ATFL right there. Okay, so now you know where that's at. We're gonna take ATFL because typically there's a lot of laxity to it, and so we're gonna take it right off of bone, and you're gonna take that all the way back till you see the perineals. So that sleeve of tissue right off of bone, and this is how we're gonna take it all off so we can reattach it, but reattach it tight. Yeah, there you go. So we've retracted the perineals, and here is CFL. Yeah, good. Okay, so CFL is sitting right there. We're going to take CFL off, and you can see it attaches kind of up underneath the distal edge of the lateral malleolus. So we're going to take that off. Tarsal sinus is, oh, there's the, yeah, so tarsal sinus is where these pickups are heading in right there, and then the subtalar joint is right in that area. So now we've peeled back our calcaneofibular ligament that we will repair back tight, our anterior talofibular ligament that we will repair back nice and tight, and now we're going to drill for our swivel locks and internal brace. So we're typically drilling 4 tunnels here. First is going to be in the distal portion of the lateral malleolus where both the CFL and the ATFL kind of meet. And so that's going to be about right there. Yep, and we're going to go straight up the shaft with this one. Perfect. And then our next one is going to be in the talus where the ATFL attaches. So this one, you want to be at ATFL insertion. Now, the way I do it, the internal brace is underneath the ligament, different than a lot of people where they put it on top. Technically, you're not supposed to put them intra-articularly per Arthrex, although we put a lot of things in the shoulder intra-articularly, and I've done this for years and not had a problem. So here's ATFL. We are right just distal to the articular surface. We're going to aim proximal and a little bit superior to hit the dome of the talus. So here is the insertion of the ATFL. So we're going to drill a tunnel right there. Yeah, so it's probably going to be about like that. Okay, now our next tunnel is going to be where the CFL inserts on the calcaneus. So you want to be 1 centimeter distal to your subtalar joint. So here's subtalar joint right here. Actually, you can see it really well right there. So we're going to come back. I can see the insertion of the CFL. You're going to drill down towards the posterior tuberosity right there, down like that. Yep. So you got a lot of bone to work with, so I typically don't use the guide for that. I'm going to expose just the inferior edge of the tarsal sinus. So I have my anterior part of the posterior facet here. I'm going to get down just so I can see just distal to my posterior facet, and we're going to drill a tunnel right at that apex there in the tarsal sinus. There we go. Yep, perfect. Okay. All right, so we're going to place an internal brace in our first tunnel in the fibula, and this is going to have half of the internal brace is going to go to the talus and half will go to the calcaneus. Okay, so now we are going to take half and we're going to put this in the talus, and I have another internal brace because we're going to take that down to the calcaneus in a sec. Okay, so the way that I do this, I think if you take that, Megan, can you hold this retractor? So we're going to expose our tunnel, and I think with both the ATFL and the CFL, when you do it this way, you got to make sure your ankle is positioned correctly. So the anterior talofibular ligament is tight in plantar flexion. So I hold the ankle in plantar flexion, and I do a little posterior translation when this goes in. I don't do the purple mark on the internal brace. That's if you're using it as a seat belt over the top. We want this tight. This is going to essentially be our ligament. So we're going to cut the limb of that coming out of the tail. So we still have these 2 limbs that we're going to take down here in a minute. So you can kind of see when we're in plantar flexion, that's nice and tight. You come up into dorsiflexion, it should get a little loose. So now we'll go back and we'll get the calcaneofibular ligament portion of that. So I'm going to let you get your eyelet. Can you see your hole? So again, we have to bring this now into dorsiflexion. That's where it's going to get a little tight. I have to bring the ankle into dorsiflexion, slight eversion, and that's going to tension this in the correct orientation. in dorsiflexion where the CFL is tight. And then historically what you would do what I would do with this suture is I would grab portions of the extensor retinaculum and try and tighten it back up to the tip of the fibula, the Gould modification. The problem with that is so many times this tissue is pretty poor, and what that does is it tightens the subtalar joint. So what I've gone to doing is taking these two limbs of the internal brace that we added to the talus. We'll put our subtalar joint, so here is a lot of inversion. I'm going to put it at neutral so they can still evert, which is fine because the ankle won't be unstable in that position, but I want to limit them in terms of their inversion. And so I hold the foot kind of at a neutral position when I'm looking at the subtalar joint, and then I dunk those two, and that should limit my inversion. Okay, perfect. Okay, so there's our tunnel. So I'm holding this in a neutral position. Tap, tap, tap. There it goes. Okay. So again, holding it in the position I want it to restrain. So now we've limited our subtalar inversion with that, so that if a patient has some subtle subtalar instability, which some of these people have, we've taken care of that problem as well. So then we'll cut those limbs. And then the final part of this is we'll repair our ligaments back to the lateral mouth. So now we'll place our fiber tack suture anchors, and we use one for the ATFL and one for the CFL. So your ATFL is going to be just anterior to the tunnel that you drilled. Mm-hmm. So for the CFL, yeah, perfect. We are going to come up just under the edge of the fibula. So it's not out here. It's kind of where the CFL originates, which is just under this lip here. Now we're going to repair our ATFL. This is a knotless fiber tack suture anchor. So he's going to grab the ATFL tissue. Yep. Nice bite from the inside to the outside, and then back from the outside to the inside. Pull in line with your fiber tack. And it should tighten the ligament up to the anterior edge of the bone. Perfect. Nice. So that's the ATFL. I'm going to pull the perineals out of the way because the CFL sits right underneath that.
Fiber tack through the CFL. And again, we're going to...
So now you can see that the ligament is nice and tight, and then we'll cut the suture and be done with the CFL.